I'm Dr. Angelique Barbara, and I'd like to thank you for having me come and talk to your club today. I'm going to be talking about kinesiology tape for animals. Some of you may be familiar with kinesiology tape. It's been used in the human world for quite some time now. You see it commonly on athletes or human patients, and it's become more popular in the animal world. There are a few small group of practitioners, such as myself, who have been taping animals for quite some time. I've actually developed some courses to try to teach other practitioners how to use this tape on animals as well. So that's what I'm going to be talking to you about today, is what kinesiology tape is and how we can apply it to animals. So I hope you enjoy the presentation. If you have any questions, just go ahead and jot them down and I'll be available to answer those for you at the end of the presentation. Thanks, and I hope you enjoy it. Okay, so I just want to start by telling you a little bit about my background and why it is that I'm here talking to you today. I'm a doctor of chiropractic. I went to school at Palmer College of Chiropractic in Florida. Before I went to chiropractic school, I received a bachelor's degree in veterinary science with a minor in equine science from the University of Arizona, and I stayed on there to get a master's degree in veterinary pathobiology. I was actually, at that point in my life, planning on becoming a veterinary pathologist is what I thought I wanted to do with my life. I then started to do things a little bit more holistically with myself and my animals, so I decided to change paths and actually go to chiropractic school at that point. And that's kind of what led me into working on animals and doing some body work and eventually starting to use the kinesiology tape. Okay, so what is kinesiology tape? It's a stretchy athletic tape that sticks directly to the skin in people and to the hair in animals, and its purpose is to improve function. The original kinesiology tape was developed by a chiropractor actually in Japan in the late 70s. His name was Kenzo Case. He was looking for a prescription that he could send home with patients to help them in between visits, and he began experimenting with already existing tapes and was not getting the results he wanted. So it led to the development of kinesio tape. So what was different about the tape that Dr. Case developed from the tapes that were already on the market? Kinesio tape stretches along the longitudinal axis, so it stretches. It contains no medication. It does not restrict motion, which is very different than the other tapes that were on the market at the time, and it's breathable and hypoallergenic. Kinesiology tape quickly became popular with sports teams, especially in Japan where it was developed, and today you can see it in pretty much any sports in the US, Europe, and Asia. And today it's commonly used in medical settings as well to help with conditions such as back pain, shoulder pain, tennis elbow, neck pain, knee instability, which are just a few of the examples of what you'll see people walking around with tape, the reasons why they'll be wearing it. In the past 10 years, practitioners have started using this tape on animals. They figured, hey, if it works so good on people, why not try it out on animals? I was one of them. I started to take some kinesiotaping certification courses for people, and with my animal background, I thought, what the heck, let me try this on animals, and I was really impressed, and it led over the years to the development of the techniques that I teach in my courses now. Okay, so what are the benefits? One of the main benefits of wearing kinesiology tape is going to be pain reduction. It provides a quick and natural reduction in the pain sensation. We're going to explain why that is shortly. The tape is also going to help improve lymphatic and blood circulation. It can help reduce inflammation and improve the circulation. And again, we're going to explain how that works as well. Another benefit of the tape is that we can actually use it to support muscles and joints. It can aid support to injured muscles, and it can reduce injury or further injury of those muscles or joints just by providing more of a mechanical support. Another neat benefit of kinesiology tape is increased proprioception. And proprioception is the ability to sense how one's body parts are positioned. For example, if a person's blindfolded, they should still be able to touch their nose, or they know where their foot is. It's just how they know where a body part is without seeing it. So now I'm going to explain to you how this actually works. So how do we get a pain reduction when we apply this tape? And basically how it's doing it is that it's able to reduce the pain by stimulating the nerve endings, the mechanoreceptors. And the more mechanoreceptors that are stimulated, the less of the nociceptors, which are our pain receptors, can fire. So it's a natural inhibition of the nociceptors is what's occurring basically as the person or animal is moving and as the tape is continuously stimulating these mechanoreceptors. I know this may be difficult to see on your screen, but here is just a demonstration of how that nociceptive afferent input is inhibited by the mechanoreceptive afferent input. So now let's talk about how we see an increase in blood flow with the tape applied. So basically, when the tape is on the skin, we're going to see it mechanically decompress the skin in the soft tissue, which you can see in the picture there. The picture to the left shows some tissue without tape on it, where the picture to the right shows the tissue with the tape. And you can see how that tape has a lifting effect, which produces some room in the tissue and the fascia, which actually allows just enough room to have some increase in blood flow with the tape applied. The way that it supports muscles and joints is basically by the way that it's placed around the specific muscle or joint to support it during movement. Unstable joints can be stabilized, and these support tapings will tend to have more stretch in the tape because it's applying more of a mechanical support to the muscle or joint. So whenever the tape is applied, you're also going to have an increase of that proprioception that we were talking about. When you're moving with the tape on, it's going to stimulate the proprioceptive nerves, and these nerves contribute to the brain sense of where the body parts are in space and time. So input can be altered due to injuries and joint misalignments, which can cause an altered proprioception, which can lead to further injuries down the road if the animal or the person, especially if they're athletes, are not moving correctly due to that altered proprioception. So there are several ways to cut the tape, which are going to help give us the different effects that we're looking for. And the 4 cuts that we're going to utilize are the I cut, the X cut, the Y cut, and the fan cut, which are pretty self-explanatory. That's what they look like. So obviously there are some challenges when it comes to taping animals. They're not people, they have hair on their bodies, so that's going to be the biggest challenge is going to be the hair. Some animals will need to be clipped before applying the tape. I have found though that most hair types, especially if they have short to medium length hair, do just fine with the tape applied to the hair. The tape will lift the hair and have that same decompressive effect as you will see in people when it's applied directly to the skin. But there are going to be circumstances where we will need to do some clipping. Also, depending on the coat type, some coats are more wiry, so we'll have to add an athletic sticky spray to it to try to help that stay on a little bit better. Another challenge seen in animals, which is not usually seen in people, is some animals may require a amount of time to become desensitized to the tape, especially some horses may initially want to run away from it just because it feels like there's something stuck to them. Some dogs may want to try to rip it off because it feels, just awkward at first. Usually most animals get used to it fairly quickly, but it's just one thing to keep in mind when working with animals is that they may have to go through a desensitization period. There are currently many brands of Kinesio tape on the market, or of Kinesiology tape rather, I should say, more so than just the Kinesio tape that Dr. Case developed. There's also Rock Tape, K-Tape, Spider Tex. There's a bunch of different brands on the market right now. I personally use the brand Rock Tape just because I've found that it sticks better to animals than any other tape on the market. Also sticks better to people. I originally started off using Kinesio tape, found that wasn't really sticking too well, tried a whole lot of different tapes when I started experimenting with taping animals, and this was the only tape that I found that really stayed on them well and that I got good results from, so that's why I've stuck with Rock Tape from that point on. The other thing I love about Rock Tape is that they offer a few different sizes. A lot of the other brands of tape just have the standard 2-inch width size. Rock Tape offers a 1-inch, and they also offer a 4-inch tape, which they call their Big Daddy tape, which is what I primarily use when I'm working on animals, is that big 4-inch width tape, especially with horses. So just another bonus to using the Rock Tape brand. Just a few months ago, Rock Tape actually launched their equine tape, which is even stickier than their original tape. So this tape works great on, all types of animals. It really makes it so that I don't need to use that sticky spray as much as I used to. So this is a really great aspect of using rock tape, as well as that you do have access to this equine tape. If anyone decides that they do want to go ahead and start doing some taping, whether on yourself or some animals, you can order through Rock Tape. You can go to www.rocktape.com and use the discount code AngelsAnimals, all one word, at checkout, and that will give you 45% off of an order. You have to have $100 or more of material in your cart to use the code, but then it'll give you 45% off of that. So it's a great code that you can reuse as many times as you want to. It's just Rock Tape's way of helping you out as far as trying out their tape and seeing how you like it. So that's a code that you're all welcome to use if you'd like to do so. So at this point, I just wanted to go over a couple case studies with you. These are just brief case studies. They don't go into great detail, but I just kind of wanted to give you a feeling for some of the things that we might see and when we might want to use the tape. These case studies were done by practitioners who took my course. They have to do a series of case studies in order to receive their certification. So these are just a couple of the case studies that I picked out just to demonstrate what conditions we might be taping for and what kind of results we can expect to see. So the first case study I'm going to go over with you is a quarter horse named Nitro. He's a 24-year-old retired barrel racing horse. This was one of my Canadian students' case studies that she sent in. He had suffered from a fall slipping on ice several years ago and had a recurrent back issue since that event. He also suffers from COPD. On October 6th, that practitioner decided to do the back pain taping on Nitro, and noted that he was definitely more comfortable with the tape on. Since his injury, he always would hold his tail to the left, and after applying the tape, his tail was actually held straight, and his strides were lengthened considerably. On October 10th, this practitioner decided to do the lung meridian taping. So this is one of the cool things that you learn in my course as well. These are some taping techniques that I developed. You won't find these in any other kinesiology taping courses, where we can influence energy flow through meridians utilizing the tape. So she decided to do a lung meridian tape since Nitro's COPD was flaring up. By the end of the 20-minute walk, he was breathing better. She still did have to give him some steroids to help with the breathing, but she did notice that the tape in combination with the steroids did seem to help him. So on the 11th, the owner decided to go ahead and repeat the lung meridian taping, and the tape seemed to improve his breathing enough that he did not require medication this time. And the owner feedback as far as all the taping that we did, she said that the lung meridian taping actually worked better than she expected. She will definitely use it again. It's not a fix for a really severe episode, but would probably work really well with the horse experiencing mild symptoms, or as in this case, in addition to traditional medication. So once again, I just want to let you know that when we're taping animals, we're not trying to replace any kind of veterinary medicine or any kind of traditional ways of treating certain things. It's used in conjunction with that, and that's when you're going to see the best effects, is when you're using these applications in conjunction with traditional treatments. So the next case study I'm going to share with you is a dog named Caution. This one I believe came from a practitioner out of Indiana. Caution is a 2-year-old Border Staffy mix. He is a fly ball dog, so he's pretty active. And he became injured playing ball in the yard, or she did rather, when she fell into a hole on May 22nd and was diagnosed with an intervertebral disc issue at that time. She had some inflammation going on. So Caution's owner brought her to the vet, where they administered some steroids, sent her home with some nonsteroidal anti-inflammatories. The vet also provided chiropractic care for the dog, and the owner took the dog home and applied the back pain reduction taping to her. So the first back pain reduction taping was applied on June 5th, and the owner noticed that after 10 minutes of wearing the tape, Caution began to relax. She also noticed that she seemed more flexible and looked just overall more relieved with the tape on. On June 7th, the practitioner decided to do a disc bulge taping over the area where the dog was experiencing some disc inflammation. And the disc bulge taping is actually a taping application that I borrowed or modified from a human disc bulge taping. And basically the way that we place the tape on, it creates kind of a suction cup over that area, which helps produce enough room in the soft tissue to kind of alleviate some of that inflammation. And oftentimes we will see an improvement in symptoms when the animal is wearing the disc bulge taping. So then on June 12th, the practitioner decided to do the hind end weakness tape to caution, and noticed that she immediately started moving better and was running around the house with the tape on. And the owner feedback was that she was extremely happy with how the tape relieved Caution's tension, pain, stiffness, and disc inflammation. So as I mentioned earlier, I have created a couple online courses that teach practitioners such as yourself how to apply kinesiology tape to both horses and dogs. I have 2 separate courses. So that's something that if you're interested in learning more, you can check out my website to find out more about that. The website is holisticanimalstudies.org, and the courses that are currently offered on there for practitioners are the equine kinesiology taping course, the canine kinesiology taping course, and animal neuromyofascial release technique. These all offer certifications. You have to complete an online exam and some case studies in order to complete that. But if anybody has any questions about that, you're welcome to contact me with questions about the courses. So what I'd like to do now is just show you a couple videos where I'm demonstrating. The first one will be an equine back pain reduction taping, and the second one will be a canine knee support taping. So I'll let you watch those videos, see how we apply the tape, and then if you have any questions at the end, I'll be available to answer some questions.
Hi, I'm Dr. Angelique Barber, and I want to show you how to use kinesiology tape with horses. Kinesiology tape is a really unique tape in that it stretches when it's applied to the hair on horses, which in turn lifts the skin and has a decompression effect. And what this can do is it can actually decrease pain. We can use it to support muscles and joints. We can use it to decrease inflammation depending on how we cut it. We can also increase proprioception, which helps the animal know where its body parts are while it's moving and exercising and competing, so that helps decrease the risk of injury. So what I want to show you today is just a common taping, one that I do pretty often on a lot of horses that I come across, which would be the back pain reduction taping, also known as the longissimus dorsi support taping. So what we're going to do for that is we're actually going to use the Big Daddy tape. Now I use rock tape because it comes in some really great sizes, and it's also stickier than other tapes that I've found. So rock tape has a 4-inch width tape that we call the Big Daddy. So this is what we're going to use to run along either side of the horse's back. So I've already measured and cut it into 2 eye strips. So I'm going to start with one of them. What I'm going to do is I'm going to tear the paper at the base so that I have a base to lay down. And I'm going to place this pretty much right along the withers of the horse. Now we're going to be going along these paraspinal muscles on either side of the spine. So I'm going to place my base down, and then I'm just going to pull this paper off and lay the rest of the tape down along the back of the horse. We're just going to go all the way down the back. I'm going to rub that down really good to activate the glue. And then I'm going to go ahead and place them down on the other side as well. I want to make sure we get both sides and try to do it as symmetrical as possible. Go ahead, place that down and rub it down. Tape along the back. Good. Rub that down real well. Then I'm going to cut 2 support pieces. And for this, I'm going to use the 2-inch rock tape. This is half the width of the 4-inch. And we're going to place 1 support piece up along the withers. Like that. along the bottom of the tape. Just like that. Now this tape can be worn during exercising. It can be worn underneath a saddle. For a lot of horses that are not used to wearing tape, I recommend that you work the horse on the ground initially before getting on them so they can get used to the feeling of the tape before you put a rider on, just in case they want to buck or move around a little bit to get used to the feeling. But once they're used to it, you can ride them in it. It's going to help decrease pain. As you're working them, it's also going to help bring additional blood flow to the area. So it's really a great tool, and this is, like I said, one of the more common tapings that I do. Alright, so we're going to go through a knee taping on Lola. She's got a little bit of instability, probably in the ACL area, so we're just going to do a knee support taping to try to give her a little bit more support. So we're going to start off, I'm actually going to use the horse tape. It's made for horses, but it's a little bit stickier, so it works well with dogs too, especially when we're taping the joint area. So I cut it into a Y, and we're going to tear it down at the base. And we're going to take the paper off on this bottom base part, and I'm going to lay the base. So now, the knee of the dog, a lot of people think it's down here. This is actually the ankle joint. The knee is up a little bit higher, so if we bend her leg, we can actually see where that knee joint is, so we know where we're going. So I'm going to place this basically right over that knee joint. And then we're going to take these two Ys, and we're just going to kind of hug it going up along the leg like that. And we're going to do one on the inside. So that's going to be our first piece that we lay down. You can actually do this either way. You can either lay the stabilization first and then put the Y, or you can do it this way and then do the eye strip as the stabilization on top of it. So that's what I'm going to do right now. So we get the eye strip cut. I'm going to rip it in the middle, pull the paper back a bit. We're going to do about 50% stretch in there because we want to stabilize the joint. So we're going to go right over the area where the patella would be at 50% stretch and just apply that right there to try to give her a little bit more support in that joint area. We're just going to rub it down to try to activate the glue a little bit better. And that is what the knee support would look like.
Alright, so I hope you enjoyed the presentation. If you have any questions for me, I will be available to answer them. If you have any questions about any of the stuff that we went over taping-wise, you can also email me at drangeliquebarber@gmail.com. And you can also visit the website, which is holisticanimalstudies.org, to see some more videos and get some more information about the courses that I offer. So I hope you enjoyed it, and I hope to talk to you some more soon.